Hello, this is Dr. Yavuz Selim Sılay. I have an amazing news. We'll be starting a brand new show where many amazing points about the dopamine as well as how things are evolved around the civilization will be touched upon. We'll be talking in very different areas of the real you, where we will be looking into the modern epidemics from dopamine to civilization. And I'm very excited to be with you today. And today, I want to speak to you not only as a family physician, but as someone who witnesses every single day one of the most preventable causes of death in the world, smoking. Smoking does not kill suddenly. It destroys slowly and silently, relentlessly, and often invisibly. As a family physician, I see patients at every stage of this process. Some come with very early symptoms like fatigue, shortness of breath, chronic cough. Others come much later with heart attacks, stroke, or cancer. Cigarette smoke contains more than 4,000 chemicals, and more than 70 of them cause serious cancers. But three substances are particularly dangerous: nicotine, carbon monoxide, and tar. Nicotine hijacks the brain. It creates addiction. Carbon monoxide reduces oxygen delivery, and tar destroys your entire lung tissue. The lungs are the first victims of cigarette smoking, and smoking is responsible for 90% of lung cancer. It is also the primary cause of COPD, a disease that slowly suffocates patients. The heart and blood vessels are next. Smoking narrows all your arteries, raises blood pressure, and dramatically increases the risk of heart attack and stroke. The brain suffers as well. Stroke risk increases by more than 50%. Smoking accelerates aging. It damages the skin, reduces fertility, and harms unborn children. But smoking does not only harm the smoker, it harms innocent people nearby. Children exposed to cigarette smoke develop asthma, infections, and lifelong vulnerability. Smoking is not a personal habit. It is a public health threat. But there is hope, trust me. Quitting smoking is possible, and recovery begins almost immediately. I've seen in many of my patients which I work with. Within 20 minutes, when you quit, your heart begins to recover. Within days, your senses return. Within months, your lungs begin to heal. And within years, your risk of death decreases dramatically. But quitting is not simply about willpower. It is about treatment, it is about support, it is about making a decision, working with professionals, and choosing a quit date. That is very important. Seeking medical help, identifying your triggers, building support systems, and most importantly, not giving up, even if you relapse, because every attempt weakens addiction and strengthens you. My dear father once described smoking as chronic suicide. Greetings to Dr. Mehmet Sılay. This may sound harsh, but it reflects reality. However, the moment you quit, you stop that process, and your body begins to heal. Your lungs, your heart, your brain, your future, and your body is waiting for your decision. Do not wait for smoking to leave you. Leave smoking first. Thank you. This is Dr. Yavuz Selim Sılay talking about the modern epidemics, where we will be taking step by step, and we'll be talking about the harms of smoking and the path to quitting from the perspective of a family physician, and where we can do and find ways to quit. And I will talk about why is smoking so harmful. As a family physician, I witness every day the silent but devastating effects of smoking on the individual's health. Cigarette smoke contains more than 4,000 chemical substances, over 70 of which are carcinogenic. Nicotine, carbon monoxide, and tar from the most dangerous trio. Lungs, smoking is responsible for 90% of lung cancer cases. It is also the most important cause of chronic obstructive pulmonary disease, known as COPD. In the cardiovascular system, it narrows the blood vessels, raises blood pressure, and multiplies the risk of heart attack and stroke. In brain, it blocks the brain vessels and increases the risk of stroke by more than 50%. Can you believe this? In your oral and dental health, it increases the risk of gum disease, bad breath, and cancers of the lips and tongue. In your skin, you're aging. By impairing your circulation, it causes premature aging, wrinkles, and a pale appearance. In your reproductive health, It reduces sperm quality in men and fertility in women during pregnancy. It increases the risk of miscarriage and premature birth. A person who smokes not only harms their own health, but also endangers the health of those around them. Passive smoking increases the frequency of asthma, pneumonia, and ear infections, especially in children. Why would you like to hurt your children, right? And how can smoking find a way of quitting? Smoking addiction is not only a physical dependence, but also a psychological habit. Therefore, the quitting process is not merely a battle of willpower, but a planned treatment process. 1. Make a decision. Set a quit date. Associate this date with a meaningful day, such as your birthday or the New Year. Do not allow the thought, one cigarette won't hurt. Number 2, seek support. Consult your family physician. If necessary, they may refer you to a smoking cessation clinic. In these centers, nicotine replacement therapies such as patches, gum, lozenges, or medications such as varenicline and bupropion may be prescribed. Number 3, identify triggers. Recognize situations that remind you of smoking, such as drinking coffee, stress, phone conversations, or after meals. Please develop alternative behaviors in these moments. Take a deep breath, drink water, or go for a short walk. Number 4, build social support. Tell your family and your lively friends that you are quitting smoking. Partner with someone who also wants to quit. Number 5, do not give up, even if you relapse. Every quit attempt brings you one step closer to success. Restarting does not mean failure. Each time your addiction chain becomes weaker, you will see that happening. Let's talk about what happens to your body after quitting smoking. I have amazing news. Just 20 minutes later, heart rate and blood pressure return to normal. 8 hours later, carbon monoxide levels in the blood decrease by half. 2 days later, sense of smell and taste improve. Only 2 weeks to 3 months, lung function improves and shortness of breath decreases. Only 1 year later, heart attack risk decreases by half. 5 years later, stroke risk approaches that of a non-smoker, and 10 years later, lung cancer risk decreased by half. My final verse, as my dear father, Dr. Mehmet Sılay, stated in his book, Chronic Suicide, the smoking epidemic. Smoking is a process of chronic suicide. Please remember that quitting smoking is the most valuable gift you can give to yourself and your loved ones. Your body is ready to heal itself. It is only waiting for your decision. Before smoking leaves you, leave smoking. Take care and all the best. Bye.